Hello, I'm Dr. Kathryn Waddington, a work and organisational psychologist here at the University of Westminster, and I'm just doing a short piece in relation to the importance of self-compassion and mental health. And I'll also make a short paper available with some of the studies that I've used to inform this particular piece. I guess there are kind of three things that I want to say. The first thing is to think about mental health in the broadest sense. We all have mental health. Mental health isn't something that happens to somebody else. We all have mental health. The World Health Organization say it's integral to everybody's health, and you can't have health without mental health. So we must break down some of the stigmas that are out there around mental health. Second thing is thinking about self-compassion. What is it? Self-compassion is about being kind to ourselves. Often if we find that we can give compassion to other people, particularly if we're caring for people who've got mental health issues or self-harm issues, but how do we turn that care and kindness back on ourselves? Studies show that self-compassion is beneficial to mental health. It helps us deal with our emotions. And there are three components to self-compassion. An American researcher in self-compassion called Kristen Neff talks about three elements: self-kindness, being kind to yourself, and not beating yourself up and not being too harsh on yourself. Second thing is to understand we all have a shared humanity. None of us are perfect. We often feel pressurized to live perfect lives and perfect worlds, but none of us are perfect. We all have imperfections, and we all feel pain and suffering from time to time. We wouldn't be human if we didn't. And the third element of self-compassion is it's about mindfulness. It's about understanding your own emotions. It's about tuning into your own emotions. And I'm going to finish now with some maybe practical advice, because as psychologists, I think we've got a real opportunity to be good role models. We're not perfect, and we need to think about what happens. How do we respond to our mental health issues? How do we respond when somebody that we're close to, somebody in our family, is having difficulties, and be able to say we feel vulnerable, we feel not okay. So I'm going to finish with three practical things. So what do I do in relation to my mental health and self-compassion? I know sometimes I work a bit too hard and I get tired and I get irritable and I get ratty and I shout at people around me. So recently, I don't know if you can see this properly, I bought myself a 30-minute, very fine-grained sand egg timer. And I try every day just to take 30 minutes. You can't see it very well because it's in the dark, but when I have this in my kitchen and the sun's shining, it's really beautiful. So I'll make myself stop every day and just do nothing for 30 minutes if it's not just looking at these grains of sand falling through this beautiful egg timer that I've just bought. I also to try and do something every week that is self-care, self-compassion. So I try sometimes to have what I call a self-care Saturday, where I just look after myself. I just do things that I'm kind to myself. And I also try to do something once a month, maybe a long weekend, maybe good long walks, again, where I'm giving myself self-compassion and kindness. I'm going to finish with two other stories of self-compassion from a book which I've recently edited that's coming out next year, called Towards the Compassionate Universities. And it's two examples from a male and a female, it obviously has to be anonymous, academic, who talked about what they did in terms of their own self-compassion. So I'm going to read them. And this is from the book, a bit of a plug for the book called Towards the Compassionate University. First is called survivor syndrome. And survivor syndrome is a common reaction to trauma, traumatic events. It's often a symptom of post-traumatic stress disorder, but this is in a work setting. This is about a time of great organisational change and redundancy. I was suffering from survivor syndrome. My workplace was gradually being dismantled. That's what it felt like to me. And that began my journey into self-compassion, to try and alleviate my own suffering during the organisational trauma that I was experiencing. So this is another academic talking. Self-compassion for me is about allowing myself time to undertake tasks that permit my heart rate to return to a normal level, to retreat to a cave of self-absorbing compassion, which means factoring time into my working week, a bit like I do, that allow for meditation, yoga practice, mindful cat petting and caring, and valuing the best that positive working relationships and social support can offer. Fundamentally, changing my mindset to have more mindfulness in my academic work allowed liberation from not being too hard on myself and ensuring I did not give up the things that are often the first to disappear in our lives when faced with deadlines, work overload, and increased change. So that's some kind of very practical examples. And the final example I want to give was from, again, anonymous male academic, and his story is called "Do You Like to Teach?" "Do you like to teach?" a student asked me compassionately. "No, I love it." But I didn't show it at the time. My usual enthusiastic delivery and spontaneity had gone, and the retrieval of knowledge during seminars was becoming increasingly difficult. A consultant diagnosed mild cognitive impairment, which was not exactly the best cure for my anxiety, which was eventually confirmed as the correct diagnosis. It was a relief to know that my employers knew and seemed to genuinely care, and that I still had a job. Colleagues, friends, and family, compassionate superiors and colleagues enabled me to reduce my anxiety, regain my passion for teaching, and now, perhaps surprisingly, consider my anxiety experience to be my superpower in the Greta Thunberg sense. It's enabled me to identify the early signs of anxiety in myself, colleagues, and students, and I've developed strategies that help to release the self-imposed guilt, obligations, and in the process, I believe I've become a better educator. Self-compassion, compassion by others, and compassion towards others can improve university experience for everybody. So just to conclude, I've given a slightly higher education university experience, but self-care and self-compassion is important to all of us. There'll be a short paper on the website that gives, if people are interested, more of the kind of studies that support what I've been saying. So nice to talk to you. Bye-bye.